constitutional rights. Our inmates are given the right to access to health care. That's the difference between being here in the community and, in my situation, being in the jail. At Prieto, I struggled for many, many years, and I advocated and I fought for many, many years to ensure that the resources were there for our patients, for our community. Every day was an uphill fight to ensure that the powers to be, the county commissioners, understood that this is something that should be done. Every day I continuously advocated for additional residents, additional health advocates, additional PAs to make sure that those resources were there. Again, because it's not a right at the community level. At Cook County Jail, I have the privilege, but I have a job that is obligated via constitutional rights. My patients at Cook County Jail have access to dental services, have access to primary care services, have access to specialty services, have digital radiological tests available to them. The top of the line healthcare services, which is as it should be for all of us, in order to ensure that our communities are healthy. Because a healthy community ensures a healthy country and ultimately makes us a much better place to be. So in my career, I've gotten the opportunity to see the full spectrum, the rainbow of healthcare options or non-options for our communities that are there. You as individuals have a role. You as individuals have a responsibility to ensure not only individually, but as a group, that we impact our health. We have a right and we have a role and responsibilities when it comes to your health, to our community's health. Via your smoking or non-smoking, via eating the right foods, via living the right lifestyles, and understanding that just saying it isn't sufficient. We have to work as a community and understand that we're different people and be able to say it in the right way, to the right culture, in the right language, to ensure that we are all on the same page. Some of you folks are going through high school. Some of you guys are going to have to make a decision on what you want to do when you grow up. I started off as a criminal justice major at Loyola University, my alma mater, and I didn't see health as an option. I didn't see health as a career. But walking through the other side of the gymnasium, I see that at least the information is getting out there. There are opportunities to, at the front line, be able to have an impact and make a career out of it. One thing that I say to the young people here, because I used to be young and I used to be in your chair maybe 20 years ago, is that choose something that will be fulfilling to you. Choose something that will make an impact in your life, but in other people's lives. Health is an opportunity. You can be a nurse, you can be a health advocate, you can be a provider, you can be a PA. The spectrum is wide, the spectrum is varied, the spectrum is exciting. I tell my residents at Prieto, you have an opportunity to play a role in somebody's life. People look to you as a healthcare professional, as somebody that will give them direction on life-changing decisions. So don't misunderstand, don't underestimate what role you play. Yes, as a provider, you will be able to prescribe the medication. You will be able to provide the direction. But your impact is even more so than that, because you will impact lives in what you choose and how you choose to do. Community is the heart of community medicine. Understanding your community is key in anything that you do. And as the young people here in the room, you are part of the community. You are coming from where ultimately you will have to return. I grew up in Little Village. I grew up on 26th Street. I've lived in Inglewood. I've lived in Pilsen. I have friends and family that are Cicero, Berwyn, everything, all the cities, all the towns that you have and that you hear about, where you have high impact crime, high impact health issues. I'm from, and I understand. You understand as a first-hand person as to some of the issues that are there. And what better person to be able to impact that with that first-hand understanding. As an allied health worker, you have that opportunity. As healthcare professionals, as providers, you have that opportunity. In 20 plus years, I've had a chance to really see again the full spectrum and the full complement of health that's provided by the County of Cook. Is it perfect? Absolutely not. Is it all inclusive? Absolutely not. But with respect to what we've done, we've focused in our attention at the community level. We've established 12 clinics out in the community, which is principally where I believe we have the best and the most impact when it comes to the outcome of our patients. And we have obligatory via federal laws focused in on the community, the cultural aspect of our communities. Again, we need to make sure that we understand that it's not just lecturing to our patients. It's understanding our patients, understanding culturally what we're dealing with, and moving in a direction where we're able to communicate that in a respectful, culturally sensitive manner, so we do have the impact that we need to have. Because again, the emergency room isn't the site for you to receive primary care site, again, because we don't have access to some of the services that are there. The hospital shouldn't be the place where we treat our patients for their chronic illnesses. We should be, and continue to, at the county at least, deal with it at community level. So I encourage all of you to continue that path that you're under. As a patient, I encourage you to be educated with regards to whatever illness you have or whatever illness our communities have, to ensure that we do have a positive impact on what we do. Prieto, and again I reference Prieto because Prieto is close to my heart, is the example by which we should be doing it. It's all inclusive. It incorporates access to services in the variety of manners that allow us to treat the person as a whole, not just as an illness, not just as a system, but as an entity, as a person, as a community. And in line with that treatment, it allows us to really affect it at a larger and a greater role. What I also do, and is peripheral to the health component, is I serve on the board for Enlace Chicago, which is one of our community organizations, which also takes a look via the NCP program, the New Cities program, on how to positively impact. It's not only dealing with the health component, it's dealing with the violence, because we frankly have and live in a community where violence is a real issue. We have to look at how do we impact our young people in a manner which minimizes the exposure to violence, and frankly in most cases deals with violence as an after effect. We have established relationships with social service agencies, with community non-for-profits. We have collaborated with the Alivios that are out there, with the Lawndale Christians that are out there, with the various churches and other organizations to look at the community as a whole. We can't underestimate the role that we all play via our interactions. And it's not just as a provider, and it's not just as an administrator, and it's just not just as a patient. It's as an entity, as a group, as an organism, because that's what we are. And it all truly affects. One drives the other, and you drive me, I drive you. And ultimately our goal should be to provide and have a healthy community out there. I can speak here for hours and hours and hours, and some of the folks know that I've been out there and have the opportunity, but I will focus in on Prieto. Prieto is one of the places that Loyola has several different programs. We have the residency program that goes to Prieto. We have 12 residents, if I'm not mistaken, that are assigned on an annual basis that run a 3-year program out of Prieto. And I've seen a maturity from the first year resident to a 3rd year resident, the ability to learn the culture, the ability to learn the language, and the ability to leave Prieto as a person that really gets it, because you need to get it. Because ultimately, at the end of the day, once you're done with your residency, you'll be an attending out there. You'll be learning, and you hopefully have learned how to deal with your patient base. So you impact that patient as a family practitioner, because you are part of the family. You are part of the extended family. You're part of the Prieto family, you're part of the Little Village family, you're part of the Pilsen family. You become part of your community. And as that community member, our roles expand, our responsibilities expand. We have an obligation to learn, understand, and provide services that are, again, culturally sensitive, linguistically sensitive, and have a focus in on prevention at the community level, because that's where it needs to be and that's where it should be. I have a lot more, but I will give opportunities at this point, so if anybody has any questions, I'll be happy to entertain those at this point. Yes, ma'am.